Hi, I'm Dr. Niedbalski at Northwest Hair. A lot of patients really have a difficult time trying to decide why they should bother to do something about their hair loss. It seems as though they're quite content with maybe just doing a transplant and getting the problem taken care of that way. Well, I really want to tell you why you should take action to mitigate hair loss. So important things that we do in this process are really taking a look and doing a proper assessment, and then discussing the progress and progression of the hair loss and trying to predict where it's going to go, and then reviewing what can be done about it. So as I mentioned previously, there's really 3 steps involved in taking action to mitigate hair loss. The first one is the assessment. So the assessment is just like it sounds. It's an examination, taking a look at the scalp, seeing what's going on there, looking for other factors that may cause hair loss. Specifically trying to determine the degree of miniaturization. That's when hair follicles, they atrophy, they shrink down, and it produces a smaller, finer hair. To see to what degree that is going on throughout the scalp, how far has that penetrated into other areas of the scalp, and so on. And then the other thing that's important to do is to take a look at the general health of the patient to make sure that there are not other medical problems or conditions that may impact what's going on with hair loss. Sometimes that includes some lab evaluations, doing some blood tests to look for things like iron deficiency, thyroid imbalance, etc. And so the assessment again is really just taking a look and determining what's going on at that moment in time. Well, the second thing is to really look at the progression of hair loss. And this is really like trying to predict the future in a lot of ways. So what we do is go back in time and see, what's happened in the last 5, 10, 15 years as far as hair loss goes. And are we dealing with a 5-alarm fire? Or is this kind of like a smoldering campfire and something that's really going on slower, and which would obviously be more difficult to see those changes because they happen so slowly. Now, family history sometimes is thought to be a really good thing to look at, and it is important in the assessment here and trying to predict the future, but unfortunately it's not very reliable when it comes to predicting how your hair loss is going to go. So the third and final thing is taking a look at what sorts of things you can do to really help to mitigate hair loss. The next level is really looking at medical therapy. So for hereditary hair loss, things like Rogaine, minoxidil, or Propecia, finasteride. And then the next tier is looking at things like regenerative treatments like ACell plus PRP. So really combining all these things in different ways are going to be individualized according to what your needs are, how fast your hair is coming out, what your response is, and looking forward to how much hair do we think you're going to lose over time. So think about it. It is a very important topic. Take action to mitigate your hair loss. I think you'll be very happy you did in the future, and you won't regret those decisions. I'm Dr. Niedbalski from Northwest Hair. Thank you for listening.